Hi, my name is Phyllis Amon, and this is Senior News for Today. In the news, in mid-December, Secretary of Health and Human Services Alex Azar said, "We can have every nursing home patient vaccinated in the United States by Christmas." But Christmas came, and most states had barely begun the vaccination process. Yet by December 30th, West Virginia became the first state to finish round one of the two-dose vaccine in nursing homes. What was West Virginia able to do that other states were not? West Virginia opted out of the federal partnership program that relied on the giant pharmacy chains CVS and Walgreens to deliver vaccines to nursing homes. Instead, West Virginia had a network of mostly local pharmacies. West Virginia has also been praised for its effective use of the time between the initial authorization of the first vaccine and when the first doses arrived in the state to plan the rollout. According to a CVS official, under the federal partnership program, the CVS plan was to have about 1,000 of its pharmacies as vaccine hubs to serve nursing home facilities across the nation. Walgreens had a similar plan. Because CVS and Walgreens won the right to vaccinate about 99% of US nursing homes that registered with the program, they had little incentive to commit a large number of pharmacies and workers to the very difficult task of vaccinating people in nursing homes. West Virginia, on the other hand, chose to utilize both independent and chain pharmacies in the vaccine rollout, which resulted in vaccinating approximately 214 nursing homes across their state. Each nursing home was served by more than one pharmacy. Getting people vaccinated in nursing homes is complicated and time-consuming. Getting consent from residents can be difficult, especially for those residents who require consent of another person because they are unable to give consent for themselves. There are also residents and staff members who decline to take the vaccine. As of January 14th, only about 25% of the vaccines distributed to nursing homes nationwide through the federal program have been administered. But by that same date, West Virginia started vaccinating new groups and began administering second doses. The local and other chain pharmacies that West Virginia used to roll out the vaccine had every incentive to provide speedy services so nursing homes would not walk away from the deals they made to deliver the vaccines. Local pharmacies also have existing relationships with nursing homes, a reason they have a high incentive to provide quality service in order to keep those relationships. In designing vaccination programs, it's important that the relationships entered into are ones where both parties are motivated and committed to the necessary resources to optimize delivery. State and local officials can make a difference when they take a strong leadership role. Even though a lack of federal leadership has been cited as a reason for the slow vaccine rollout, West Virginia was able to succeed in vaccinating nursing home residents because it operated outside of the federal program. The US is only at the beginning of the COVID-19 vaccination process. Just over 3% of the country's population has been vaccinated as of January 13th, and there are many challenges on the road ahead. Even in West Virginia, about half of the nursing home staff members declined to take the vaccine. These all have implications for the success of the vaccination program and our ability to get control of and eradicate the coronavirus so we can return to a more normal way of life. Please click the buttons below to like and share this episode. And to continue receiving Senior News for Today, please click the button below to subscribe. Until next time, stay safe, stay well, and stay tuned.